Good afternoon. Thank you for joining us. This is Rachel Leventhal Weiner, our Chief Research and Planning Officer at the Office of Early Childhood. We're glad that you were able to make time today to join for an update from our Commissioner about early childhood and the state of the field during the COVID response. We wanted to remind you that during this broadcast, we will be able to take questions using the questions pane on your GoToMeeting dashboard, and we will respond to those questions later in our broadcast. And with that, Commissioner Bye.
Thank you so much, Rachel, and thank you everyone for joining us today. This is the Friday of the Week of the Young Child. This usually ends a week of celebration and appreciation of early childhood educators, from home visitors, birth to 3, early childhood educators. I think we do need to celebrate today, but we know that our field and our programs and our families are struggling right now with many concerns. But because it's a Week of the Young Child, I had written a little something about what the Week of the Young Child meant to me, and I wanted to read it to start so we sort of have a moment before we go into our COVID responses to think about early childhood educators. So here it goes. It was September of 1994. I can feel every inch of the moment I entered Trinity College Community Child Center. I handed my colicky 7-week-old baby to Debbie, Tina, and Beverly, the infant room teachers. Baby Caroline had deep blue eyes and a smile that, when it appeared, could make you instantly forget just how hard she was to calm down. Her sister, a young preschooler, was already heading down the hallway to Mirta and Maria, to a comfort zone where they called her Niña Linda. That moment is cemented in my memory by the ache a new mom feels leaving her newborn, mixed with warmth and love and support from those incredible teachers. Any parent who's partnered with childcare teachers can still feel their love and caring for the children and for the parents, and has tremendous gratitude for their service. We understand the value of early childhood educators and administrators. We know the impact these professionals had on our children and on us as parents. They took that sad, anxious, and unsettled parent and helped us self-regulate with care, information, and love. These individual appreciations have not translated into a cultural appreciation of early childhood in the United States or in Connecticut fully. Early childhood educators subsidize businesses and families because they take substandard wages and benefits. And we know that this impacts our field, our programs, and ultimately children who we all care so much about. And it really stresses families as well. During the Week of the Young Child in 2020, many parents in early childhood settings are dealing with those emotions of leaving their children while they're dealing with COVID-19 worries for their families. And early childhood professionals are supporting them still, while they themselves are working on the front lines of a pandemic. They have their own worries for themselves and for their families, and early childhood educators are heroes in this challenging time, and they're being recognized for that. As Commissioner, I just want to say how grateful I am for the early childhood professionals who are helping community members, who are helping our state, and Governor Lamont has been incredibly grateful as well. And in 2020, as a field, we need to be thinking through how we use a cultural appreciation of early childhood and childcare to shine a light on the value of this field and work to develop systems that meet parents' needs, that support our workforce, and most importantly, lead to optimal child development of Connecticut's children. Because we know when we support the optimal development of children, we create a more optimal state. This is no small task, but we have a moment here when early childhood is being appreciated. And the Week of the Young Child is a time that we've always considered these kinds of issues. Back in 1994, I wore a handprint of baby Caroline to work during the Week of the Young Child because early childhood educators were working to raise awareness that we would not be at work if we didn't have childcare. I still have that laminated print. I was holding it in my hands a couple weeks ago because there seems to be time to sort through boxes right now. But it reminds me that we've come some distance as a field and made progress, but we have a long way to go. and together we will make progress in Connecticut and across our country. So I'll stop there. And I hope you appreciated that. I know I'm so grateful to the early childhood educators I mentioned, and we lost Maria this year. Maria Cabral was an incredible early childhood educator. So what I'm going to do now with y'all is walk through the OEC responses to COVID-19 as part of this town hall. And then I'm going to take questions and do my best to answer them. And whatever we can't answer, we'll work to get back to as quickly as we can. I like to believe that our response to COVID-19, and I do believe this, and I know it to be true, is grounded in being responsive to your questions, concerns, ideas. We've incorporated many of them in our work. And I also want to just have a big shout out to the staff at OEC who are working morning, noon, and night, I promise you, doing our best to respond to a very unpredictable situation. But for our staff has been amazing. So let's get going. Teal, our partner at O'Donnell, is going to walk me through this. One of our previous town halls, this is a quote from Lieutenant Governor Bysewicz about how important childcare workers are, that they're playing a very important role at this time. And some of you heard it and some of you didn't. We're getting better at the technology, but I was on a call with Lieutenant Governor yesterday who continues to talk about the value of this work. So Governor Lamont and Lieutenant Governor Bysewicz are really grateful for your service. So what are we doing right now for providers and families? And I know some of you have heard this, but bear with us and be thinking of questions while I'm speaking. But what we've tried to do is share guidance with programs based on CDC and Department of Public Health that is accurate, and we believe that is also helping promote public health and wellness. We've been issuing guidance for providers. Our website has been updated tremendously. I think if you're a provider, open or closed, it's worth checking in every day because things are updated all the time, both for families and for providers. And we have a significant social media campaign that I'll share with you some in this webinar, some of it. We've also been standing up programs, and we have a couple on the horizon. But we're calling them broadly Connecticut Cares, which are programs where we're working to care for Connecticut residents. We're also have our standard programs going, early childhood, birth to 3, home visiting, and licensing, but all of them are turning their attention to some of the challenges faced through COVID. We are also really working to think about early childhood as a business. When I say that, and I think a lot of you will agree, yes, we are small businesses, but we're also part of our state infrastructure. These are not, it's a mix. Connecticut has a mixed model of providing early childhood services, but we do believe that we need to use the supports that are out there to support our childcare businesses. We are sharing information as well on safety, but we're also sharing information about what are the resources out there to help you. And we're really right now also thinking about how can we help programs that have faced such challenges fiscally reopen? What are some of the things we can do there? And we are working under the Unified Command and working across state agencies to think through this, and we will be reaching out to you for information so you can tell us what are the things you need because you are part of our critical infrastructure. So throughout, we've been trying to be really clear in our guidance, as many of you, well, probably, obviously, everyone on this call knows that the goal is for social distancing to try to limit the spread of the disease. So first of all, we're saying if you can stay home as a parent, or if you have someone at home who can stay home and watch your child, keep your child home. If not, turn to neighbors and friends. And if you don't have neighbors and friends, then call 211 Childcare. We do have programs that are open and have spaces, and we've been driving essential workers and others to that, frontline workers, to programs that are open. And we've also been issuing those programs guidance about public health practices. And then we have a special number for 211 on 211 for first responders and healthcare workers, so that we're sure they're getting guidance quickly on finding childcare. Some of the guidance that we've given, you can see here, it has to do with small groups, frequent hand washing, sanitizing, and making sure any signs of illness that children and staff may not come into the program. I already said to you that we update our COVID-19 OEC response page regularly. You'll find resources for families. Whether your program are open or closed, I know those of you that are closed are doing incredible work reaching out to your parents and families and working hard to stay in touch. There's some really great resources here. Michelle Levy from our office did a video with Andrea Brunell from SDE about how do you teach children at home, young children at home, and giving appropriate guidelines. So I think you'll find this page helpful whether you're open or closed. And also, I think you can help parents find this page because parents are really relying on you for information. They trust you, and they know you care about them and their children. So please do go to our website. We work to keep it updated regularly. I mentioned our social media posts. O'Donnell and Company and the OEC have been working to develop a brand that parents would trust. And thankfully, that work's been done over the past 12 months. And you can help us get this information out there. If you see one of these posts, you can share it. And look at some of the number of impressions. Like when we did important updates, we had almost 30,000 views of that. So people going and getting important updates. How do parents deal with coronavirus? And then our third top post is the post where we were saying thank you to early childhood educators and thank you for your service to our state, which is quite telling. Some of our other posts have been about families. Teal, if you can just go back there, thank you. And about updates. And I wanted you to come back to this one, Teal, because the fourth picture all the way over on the right around birth to 3 still being open. Here's where I'm going to ask those of you on the call to help us out because you'll see a graph in a minute that we've had a tremendous drop off in birth to 3 referrals and birth to 3 services. And you and I, we all know how important it is to get to children and families early, particularly when there are concerns about children's development. It can make a difference for the rest of that family's life. So we hope you can help us by making sure that families who were engaged with birth to 3 and in care with you, maybe check in with them and make sure they're still getting services. Or if they're children you sort of had concerns about, but you didn't quite get to, that could be a good parent to say, hey, why don't you call Help Me Grow, look at the ASQ, do a screening. So we could use your help with that. And so we have a social media campaign telling parents that birth to 3 is open, and we have other parts of that social media campaign. We have also created emergency childcare for hospitals. It's known as Project 26, making sure that we have childcare available for them. So that program, we are now covering 29 hospitals with community-based providers. It's a total mix. We have YWs, YMs, private programs, public programs. It really has to do with what programs were closest to the hospitals. And so we have stood those up, and they're doing incredible work. The idea is to be ready for the surge, and these providers have been unbelievable. And let me just say one other thing. So while there are 29 programs open for 29 hospitals, let me tell you how many other programs contacted OEC and said, hey, if that doesn't work out, or if you have more of a need for childcare, we're ready to help. We had 83 programs reach out to us to say, we want to be part of the response to, we will be helpful. And it just speaks to our industry. I should also say on the healthcare, one that the calls coming into 211 are by far the most are hospital workers. It's hospital workers are about 50% of all the calls. The next closest is 15% with nursing home workers. And after that, you're into single digits for every other frontline worker. So I think the program at the hospitals has proven to be the right choice of Governor Lamont and our agency to make sure hospital workers had that care. So this is just more of a description of it. It says 23 hospitals, but we're up to 29. I know I'd fix that on one of the versions of this PowerPoint I saw, but I must have gotten that one through. So we are now at 29 hospitals. We're constantly monitoring and assessing and making sure those programs have what they need and are connected to the hospitals, and children are referred directly from the Human Resources Department. It's important to say that if a hospital worker goes to the HR department and says, I need care, they are first directed to 211 Childcare to use existing supply in the community. And if they come back to Human Resources and say, I can't find childcare, then they're directed to a Project 26. There are only 26 spaces, so they're small programs meant for emergency childcare for employees who can't find care in existing programs. So this is on our website, and you can look that up, more information if you'd like it. So Governor Lamont has been really clear that he wanted childcare to stay open for essential workers. Some governors said childcares need to stay open. He did not say that, and neither would I. Programs made their own choices for many reasons. Local health made different choices. It's a complex milieu. As I said, we have a complexity of programs in Connecticut, and we're totally respectful of programmatic decisions, and we trust your leadership for your programs. But enough has stayed open for essential workers, and that's actually been a good thing for Connecticut's response to this coronavirus. So Connecticut Cares for Childcare, I expect we'll have a lot of questions about this today, and I'm happy to answer them, and I'm going to answer some of the questions up front. But what we were trying to do was reward programs that stayed open, and with that, send bonuses for programs that are able to stay open and serve essential workers, recognizing that being open with required small group sizes, with teachers going into work given the pandemic with higher risk factors, that they should be compensated for that work. We have sent bonuses to child care programs. And I want everyone to understand that we had to launch this very quickly, and we were building it as we were rolling it out because we wanted to be set up to get the funds out to the community as fast as possible. And so it wasn't a perfect start with the technology, and we appreciate your questions and your patience because, as I said at the start, your questions and your patience has led to a much improved system, and a system that's more responsive to providers. And some of your questions about group size and family child care and who can get it led to us easing a lot of the restrictions to make sure that people serving essential workers can receive additional compensation. So we've been shifting the way we work at OEC. There have been some changes. Home visiting is happening virtually, and our home visiting providers have been working hard to reach their families. And we're all getting better at using technology, right? I mean, I remember how opposed I've always been to technology with very young children, wanting them to focus on those executive function and social emotional skills. But right now, technology is important. Things change, right? There are a lot of songs about that. But anyway, so home visiting continues virtually. I'm really proud of the home visiting team as well for their work collaborating with Diaper Bank. They have been able to access diapers and wipes for every family who's in home visiting. As many of you may know, home visiting is serving children who are at risk to begin with. So these are families that have a lot of challenges, and they're all going to get a month's worth of diapers during the pandemic, which is really great. So we're doing our best to support families that way. I talked to you earlier about birth to 3 being open, and it's important that you can help us get that information out there. OEC is also, we have recently gotten permission from the Office of Policy Management and are waiting for an executive order to put this into law. But birth to 3 can continue to serve families who've now qualified to go to the public schools because they're 3, but birth to 3 can continue to serve them through the end of May as part of birth to 3. So this is important for you to let your families know. Even if, again, open or closed, you know what families were in birth to 3. You can let them know that OEC and the State Department of Ed and the Office of the Governor have worked it out so that they can continue to receive birth to 3 services. I asked O'Donnell to put this slide in from our birth to 3 folks. What you see here is that the blue line is the calls to 211 Child Development Info Line, and the red line are referrals to birth to 3. So we've just had a slight uptick, but if you look at the top of that graph to the bottom of that graph, we were going with about 225 referrals a month to birth to 3, and we're well under 100. It looks like we're about 65. So think of all those children right now losing ground because they're not getting intervention as they need it. So again, help us out. We're going to have some public outreach, and we hope that you will add on to it when you see things on Facebook, or if you send emails to your own families. Please refer them to Child Development Info Line if they have concerns about their child's development. We've also been working with the State Department of Education under the ESF 6, which is the Emergency Service Function 6, for the emergency response for the state, to make sure that families have access to food. We know from the calls to 211, one day on the Unified Command call, 211 reported that the top 5 calls, so they picked topics, the 5 top topics people were calling about were food. So families and individuals in our state are hungry, and we are working really hard to do outreach to give information to families about WIC, about their public school food available, about other food resources in their community, food banks, and where they can access food. So this is a real challenge right now, and I'm proud of the work we're doing, getting information out to families. But we're going to have that food flyer is out and available on our website. So if you go to the OEC website, you can find a flyer in English and Spanish to share with your families or share with your networks so that families can have access to all the different ways they can get food. So, what can you do right now? You can stay safe. We're all going to get through this. Connecticut's children need you now, and they also need you later. So I think health is the top priority right now, and certainly as a state, we're understanding that. Stay connected with us. Stay connected with your local early childhood council. Stay connected with each other as much as you can. We're going to continue to try to provide you information about government programs to help stabilize your income and businesses. And you can also share your expertise with the community through social media, discussions, calls, contacts, etc. I think don't underestimate your role in the community. People look to you as leaders in your community. People trust you. You are ambassadors for children and families. Families know and trust your information. So please, anything you can do to help get word out to families about some of the items we discussed today would be really helpful. Thank you. Thank you very much. And now I'm going to go to some of the questions. I want to make sure you have our COVID website address. It's www.ctoec.org. /COVID-19 /. I always just go to Google and put OEC and then CT, and it brings me right to our website, and the COVID sites right on the website. I also want to reiterate something that childcare is open right now. Families programs can remain open. Many are serving essential employees. Some are serving frontline workers. Some are serving families that may be teleworking and need a break. But childcare, there aren't restrictions in Connecticut by the state about childcare being open. We know there are several communities that have those, but we do not. So I just wanted to make that clear. So I'm going to stop there and see if Rachel or Nicole, if there are questions for me.
Okay, we have several questions to begin about supplies and recommendations about health and safety. So if you could talk a little bit about if people are having problems getting supplies, what are some of your recommendations?
Yeah, I really appreciate that question. So OEC has been working with the Emergency Operations Center on accessing supplies. We have been trying to get a hold of hand sanitizer, soap, and now PPEs. So we have received some of these items, and we are working with 7 regional locations that will be able to distribute it to programs that need it. And we are communicating directly with programs that are open through United Way and through our software that emails to open programs. It is important that programs let 211 know that you are open. Make sure they're aware that you're open. And many of you have let your child care licensors know about your concerns as well with supplies. And so those have been passed along. But know that you will get an email about when hand sanitizer and soap and thermometers are available, and it will be very soon because we've been pushing and pushing. There's, as you all know, everybody needs these supplies, and we have been able to make the case that childcare is essential, and the childcare programs are having a very hard time getting hold of these supplies. And if we want them to be open, then we need to have these supplies accessible. So I know people in the Danbury area were the beneficiaries of some supplies because of a local manufacturer who worked with us to manufacture some hand sanitizer. But we've now got enough for statewide distribution, and you'll be hearing from us very soon.
Can you talk a little bit about the recommendations that exist right now for adults and children to wear masks if they are required, and how providers can wear masks to keep themselves and the children safe, but also make the children feel comfortable and not scared?
Yes, we have a very thoughtful memo coming out today. It's Memo 6 has been updated to update for the new CDC rules about wearing masks, and there are also rules by the governor in the state of Connecticut about providing masks in the workplaces. And we would all agree that early childhood settings are workplaces, and that workers there should have access to protective measures. So there is a requirement around masks in public, and it says where that's possible, because we know there's a big shortage. But in Memo 6, and you will find it now on the CDC website, there's a whole section for schools and childcare about how to make a mask. It can be a homemade mask, or it can be, a medical grade mask. But there's no call for a medical grade mask. I do think, you're asking me, what about the children? I think very often, you all can agree with me or not. You can hit it hard if you agree, but children tend to be more adaptable than adults. I think it's really, this is all hard, right? It's hard in our homes. It's hard in our neighborhoods. It's hard in our communities. And children are needing to get used to this right now. And we do have some resources on our website about talking to children about coronavirus. So I think it's about communicating clearly with children And I think, as everyone's doing it, then children will do it. It's difficult also because, children are going to be futzing with them and touching them, and they may be putting their hands on their face more than they would if they didn't have a mask. But I think it's a matter of communicating and helping children adjust and helping adults adjust. These are unusual times, and we're being called on to be on the front lines, and many of you have taken that call, and some of you aren't open, but you're doing other things to support your community, and you're keeping your family safe, and that's all great. But I was asked, and we are going to answer this, we were asked about putting together a webinar about working with PPE and helping providers. And so we'll be working on that in the very near future to get one of those out. And if you have suggestions and you want to send those to your licensor or OEC or have been successful in implementing this, let us know and we'll share your knowledge.
And lastly, under the heading of health and safety, what should the response be if one of the parents of children in care contracts the virus, if there's exposure? How should they handle quarantining or accepting that child back for care?
I really appreciate that question. Let me just say, having been run through several examples, both as a supervisor and working with childcare programs, all I can tell you is that every single case is individual. What you or I might think will be the recommendation might not be the recommendation. So every time there's a case that you have a question about, you should contact your local Department of Health and you should contact the Department of Public Health, and they will talk it through with you. And I know there are probably directors on the phone who've done this with me, with the Department of Health, and follow their advice. It's very specific what they will recommend specific to that case. The other thing I really recommend, and not just recommend, I would say this is beyond a recommendation. It's a very, very strong recommendation. Communicate with all families about these cases. If I was a parent in a program, if I was leaving baby Caroline with you, I would want to know what's happening in the program and when there are cases that you're asking about, so that they're going to trust that you're communicating with them. And I'm sure you all do, but I think that's important.
So there are several questions around age restrictions that impact enrollment, having to do with infants and the adjustment of perhaps taking more children under age 24 months. So can you speak a little bit to, especially for family child care providers, the possibility of modifications to enrollment size or choices around enrollment size?
I don't think we have any plans to make changes around enrollment size. I mean, people can contact me directly about that, but we are staying with our current recommendations. I know that with family child care, there are differences right now. For you may have school-age children who are there all day instead of just after school. And that's important, but we don't really plan any changes around infants or toddlers at this time, but we're open to your feedback.
Okay. The next set of questions have to do with Connecticut Cares for Childcare, and we have a few questions around the enrollment process. So first, about needing more categories for the different kinds of essential workers that exist. And then an overview of the way that the payments will work and the way that the bonuses will work.
Sure. So basically, the enrollment process is on the web page, and if you're having challenges on our web page, I'm looking for the email right now. There is a email that you can send your questions to, and that applies to.
The email address is, I'll put it in the chat window. It's ccc.oec@ct.gov. I'll put that in the chat window. And that's in the event that we did get a few questions around mistakes in enrollment or issues with enrollment.
Yes, I'm sure I tried to say we have been building this. We're building it as as it's starting to fly, and we do apologize for that. And I know some of you have had to go back in twice. So that is my answer there. But do send your questions, and I think the enrollment process is also on our website. You go in and you have to enroll in the program. You have to answer some questions, and one of the questions when it comes to filing your report for the children who are essential workers does have a pull down menu for what the parent's job is, because it's important to know that not everyone in every center is an essential worker right now. This program's designed for programs that are serving essential workers. So that's how that's going to go. What's the other part of the question, Rachel?
Well, just to be clear, for the question regarding the categories of essential workers, we have several questions that say they are not able to find the categories for their parents, and it's just important that folks know the IT team is working very hard just to update the new enrollment system. So the feedback is really helpful. We devised our list based on Governor Lamont's list of essential workers, and we knew that there might be gaps. And so we're continuing to develop and roll out the program, and we're updating that field in our system. So we hope that update will be pushed out tomorrow morning. And in addition, there'll be an attestation for parents that they are essential workers that'll be on the website as a PDF for download as of tomorrow. So just look for those things. If you've had challenges trying to enroll children and you don't feel like the fields that represent the parent occupations are available in sort of an accurate way, do your best, but also know that we're really working hard to make sure that everything's reflected there.
Thank you, Rachel.
And then the next question, Beth, was the bonus forms. So in terms of when payments will go out, how the payments will work. I don't know, Chris Liddy, I know our Chief Operating Officer is on the call. I don't know, Chris, if you want to jump in here and offer an answer to this question.
Sure. Well, good afternoon, everybody. This is Chris Liddy, Chief Operating Officer. So again, we appreciate, I would echo Commissioner Bye's comments about your patience with the rollout of this. We are being relatively agile in our response, and we are taking your feedback that comes in daily to help inform the process. Right now, we're planning to have the first round of payments go out next week, and that will be to everybody who has successfully enrolled in the program, submitted their W-9, and who have been successfully entered as a vendor to the state of Connecticut. And that really is the challenging part. The challenging part with regards to timing is there's a lot of steps behind the scenes to ensure that your information gets successfully entered into the state's accounting system so that you can be paid as a vendor. So for those people who have successfully gone through that program, through that process, and have entered their attendance for this past week and last week, we are anticipating that a bulk of the payments should go out sometime next week. There will likely be a few batches of payments in our first cycle. And the reason why we want to do this in batches is because we want to make sure that the process is accurate and that there are no glitches. And that way we will limit the amount of corrections that we will have to make. So going forward, the plan is that providers will have until 5 p.m. every Monday to enter their information from the previous week. Initially, we had it being at 5 p.m. on Friday of the same week, and based on some feedback, again, we pivoted and adjusted to make sure that that process was as flexible and reflective of your process as possible. We hope to get the payment files to the Office of the State Comptroller by Thursdays of each week. So we will have a regular cadence of downloading your information, calling through it to make sure that it is accurate, working out any glitches, getting it to the Office of the State Comptroller for payment, and then they will release payment either on Saturday or Monday of the following week. I do want to make sure that you all know that just because payments are delayed right now, you will get paid. That is our goal. We want to get the money into your hands. I don't think the state says that all the time, but in this case, we really, really want to make sure that the payment is in the field And so we want to make sure that it's accurate and pretty agile moving forward.
Yeah. Chris, thank you so much. And I do want to say, I mean, we are grateful for your patience, and we do know many of you are really struggling right now, and that these payments and getting them out quickly is so important to you. And so we are doing everything humanly possible to get those dollars out as quickly as possible. It will not be a Care for Kids situation. It will be a couple of weeks
for those folks who have,
before the funds are out.
Sorry to interrupt, Commissioner Bye. For those folks who have sent a question just saying that they have sent an email and haven't heard back, we appreciate your conscientiousness around making sure that you have your information in on time. So just know that we're processing with a very lean team to get all of these things accomplished at a rapid pace, and so we'll get back to you as soon as we can, but we're being extremely responsive. I had one question. I just wanted to clarify a comment. Commissioner Bye, you said that child care centers can be open, but that's with restrictions, correct? Following all of the guidance that we've outlined in our memos. We do have a comment saying that they heard you say that they could be open with no restrictions, but that is not the case. We have extreme restrictions on group size,
what I was
on
saying,
health screening. Please just reiterate so that that's very clear.
Well, I think that what I was trying to be clear is there were questions coming in about, is childcare just open for essential workers? And I was making the point that the childcare is open for frontline workers, for essential workers, and for other workers. The governor did not close childcare, but he didn't close childcare, but we have very strict public health practices that have to be in place if you want to be open right now. And from all accounts, you all are being incredibly responsive. Look, we're a group of people who keeping kids' health and safety has always been our priority. And we know the challenges right now, and we also know there's no perfect. So we're all doing our very best in this moment, and people are following the public health guidance. We're hearing from families, and they're very grateful for you.
So our next set of questions have to do with guidance about the potential for reopening. If you could speak a little bit to what that will look like, whether we will offer guidance, any recommendations around when that might be happening, and how it might be impacted as the surge of infection has been different across different counties across the state.
Yeah, I think that the governor has a whole team that's looking at this across the state. I think if we think of childcare as being an industry in the state, supporting other industries, and also an educational proposition as well, that there will be guidance issued from our office and from the office of the governor about reopening. What we do know, and what we're trying to learn from other states as we talk to them about how they're approaching this, is that reopening is going to be a challenge, and getting enrollments up is going to be a challenge. And our industry counts on, our programs being full to pay our bills. And so we know there are going to be challenges, and that's where we're going to be asking you for feedback about how we can support you in the reopening process. But for now, we know right now it's not safe to lift the public health restrictions that we have on programs that are open. And it's a pandemic, which by definition is unpredictable. So I'm sure it's very hard for you to plan, and I don't have a single answer right now. The governor has schools closed till late May, and we don't know if that will change, but that's where things are now. And so I imagine that things will be much like they are now for another month. And there are surges at different times. But even as, the surge has moved up toward New Haven and Hartford, I heard today that Stanford Hospital is busier than ever. So it's states with different regions, but we're also a pretty small state.
To go back to just one question around the Connecticut CARES program, we do have a few questions around the timing. I believe Chris spoke to if and how payments might be retroactive. We do have a few questions, though, about why it's just covering a specific portion of the pandemic time, knowing that we're, effective this current month, for instance, but folks were providing care back in March. I just wasn't sure if you'd want to speak to sort of how these things came about.
Sure. Well, the program started when we got approval. It was not designed to go back. This is sort of how we budgeted for it. We had to show that we could apply funds toward this and how much we could apply and how far those would go. And so it starts as of, I believe, Chris, what was the date it started, the very first date where we're reimbursing? April 6th, I want to say, but that could be wrong.
So initially, yeah, we had April 6th as the first date, but because the reporting week, again, based on feedback from the providers, we moved it back to April 4th. So we gave an additional 2 days, which is not a lot, but again,
okay.
We took that provider feedback to, yeah.
Okay, thank you, Chris. Yeah.
Sure.
And then we have a few questions just thinking about either programs that serve families that are starting to get worried about summertime, or programs that run summer programs themselves, and just they're starting to anticipate summer, and if we have any thoughts on what summer might look like.
Yeah, well, I just said some things are unpredictable, but
yep.
As of next week, we are going to be talking to summer camps, much like this call. We're going to have one with summer camps and hear their feedback and their questions, because as we've noted, we have some very strict public health guidance around group size and screening, et cetera. And right now, those would all apply to summer camps. So we are going to listen to the public health guidance, and we are going to work with our camps to communicate. And many of you aren't just childcare programs, you also offer camps. So I don't have an answer right now, but I know this is important to families and important to you all, but I just don't know is the answer.
Okay. We do have a few questions about unemployment. And I don't know if we want to speak to these now. One thing we should tell everyone who is listening in, we have taken every question and turned them into the frequently asked questions that we put on our COVID-19 website. And so if we don't answer your question specifically, or we get in the neighborhood of answering your question, but it's not the perfect answer you were looking for, just know that sometimes we don't have the answer on the spot, but we try and get the most accurate information to share on our website. So you can always follow up there or follow up with us directly. I don't know if we want to speak to unemployment, but there are a few questions around challenges with unemployment. I don't know if either Commissioner Bye or Chris have any.
Well, I'm sure there are questions about unemployment, and this is, I know, been a real challenge for people to navigate. We have links on our website that'll bring you to the Department of Labor, where they have frequently asked questions about that, or you can call Department of Labor. I don't want to give bad advice on this call. I know about early childhood. I'm not an expert on unemployment, so our office and our ESF 14 has been working to make sure those links are on our website for you to access Department of Labor. I don't know if anyone wants to add on.
No, Commissioner Bye, this is Chris. I would just say that to provide some context around unemployment, the state has received well more than quadruple the amount of unemployment claims in the last 4 weeks than we received in 2008. And so the Department of Labor has worked really hard to try and manage that volume, including recalling state workers who have retired, who may not want to come back to work, but it is a mandatory recall. So the state is really pulling in every resource they can to process the unemployment applications currently.
So we have a few questions about the Care for Kids program. If, as a part of the Connecticut Cares for Childcare, they're supporting and providing care for children who receive care for kids that typically goes to a different provider, or redetermination paperwork has arrived for a family they're currently serving, but they're closed. For Care for Kids related questions, what can we offer to folks today, and then where can we send them for more frequently asked questions in the future?
Well, as many of the listeners know, we will be paying Care for Kids through the end of June for children who were enrolled in March, so March, April, May, and June. We will also be auto redetermining, I think, which means just approving redeterminations for a short period of time. Let's try to reduce some of the paperwork and burdens on providers. But you can call Care for Kids, and I know the call time, the wait times are very low right now. They are doing okay for staffing, and because of some of the changes of just automatically paying, et cetera, they have some time. So you can call 211 Childcare and ask for Care for Kids, or you can call the number on your Care for Kids form if you got one in the mail to ask your questions.
And that's even for providers who are currently closed.
Yeah.
Okay, great. I think that we've covered the majority of the themes of the questions that we've covered. We appreciate the feedback about the communication. We did have a webinar like this with the field back in December, and we've gone to this format during this time so that we can be in closer communication, so you can hear things directly from us. And as I just said, we have been reformatting all of the questions we receive into a very detailed set of frequently asked questions that we hope will provide you with the information that you need. So on that note,
okay, thank you so much, Rachel. And let me just again reiterate my thanks to the team at OEC for putting the call together and all the work that's going on, working to communicate. We know we can always do better, but we really we depend on your feedback for us to do better. And you've been doing a super job of keeping us informed about your challenges and your questions and ways that we can improve what we do. But I want to close on behalf of Governor Lamont, who is so grateful to the field for their response during this emergency, and say thank you. And we will host another one soon. So thanks for your service, and we'll be in touch. Have a great day.